So today's Q&A with Dr. Parekh is because I feel as a mother I was so unprepared when my kids got COVID and I completely was in a panic. So I believe that we are better armed with information to make sure that we look for the signs, we are alert and we are protecting other family members in the house. So I hope this helps, guys. Please listen to what Dr. Parekh has to say and stay safe.
Now let me explain you the pattern of how this virus behaves in every child. In most of the children, it starts with normal symptoms of the flu. So it's impossible for you as a parent to differentiate between COVID and the flu. Let's keep it simple. If your child gets fever today more than 100, 100.5, with or without any other symptoms, pick up the phone and talk to your pediatrician immediately. It is extremely important for you to talk to your pediatrician because he or she will make a note that your child has started the fever. From their experience, they know that right now most of the fevers that kids are suffering from have a high probability of being COVID. So they will advise you, which you will do, is to give simple fever meds for the first 2 days and look out for other symptoms in the first 2 days. If it's a mild viral or a mild COVID or any other viral, the fever will go in the next first 2 days with just paracetamol and you may not see any other symptoms. If it's something more significant, fever will last for more than 48 hours and other symptoms will start like loose motions, vomiting, rash on the skin, difficulty in swallowing, cough and cold. So then you immediately talk to your pediatrician who mostly will have you over by the second or third day of high grade fever. Now going to your pediatrician is extremely important because this is the time your pediatrician will be able to clinically assess the child. Assessing, self-medicating, self-assessment for adults is easy. Talking to doctors on video calls and video conferences and virtual appointments are fine. But when it comes to kids, clinical examination is the key in person for your pediatrician because they can pick up things on examination which you can't demonstrate through your phone or through video calls. If the child is sick looking enough, he may run or the pediatrician may run some basic blood tests to know the level of viremia or any other causes of fever. They'll rule out malaria, they'll rule out dengue, they'll rule out a bacterial blood infection, a urinary tract infection, and nail it down to low counts, low platelets, maybe a high CRP to kind of give you a semi-confirmation. Okay, look, this is 99% COVID, so everybody mask up at home. That most of the kids are recovering well within 3 to 5 days. So it is a short-term disease. We've not seen any kid having fever for more than 7 days. So, and post that, the recovery is very quick. When it comes to elderly children, about 10. So we've seen COVIDs in kids anywhere between 1.5 years to up to 18 years of age. Now when it comes in kids more than 10 to 12 years of age, when it's adolescent children, once they get COVID, we've seen some of them recover but suffer some long-term consequences, which is known as a long COVID syndrome, where post-recovery for a period of a month and a half, all of them suffer loss of appetite, extreme fatigue, fogginess of the mind, not able to concentrate, on and off fevers, loose motions, cramps in the stomach. So this is called the long COVID syndrome. There's not much to panic here because the body does recover, the body does do well over a long-term period and there are no long-term consequences, nothing over 6 months to a year. On the other hand, the COVID is so new and so young in pediatrics right now that we don't know what will happen 6-8 months down the road, but as of now, it doesn't look like kids will have any long-term consequences. The most dreaded form of COVID, which we've not seen as much in the kind of patients we're seeing, but we are reading about it and people are panicking when they read about it in the papers, is something called MIS-C, which is the multisystemic inflammatory syndrome in children. This is a much dreaded complication of COVID, where out of experience and seeing kids of MIS-C, pediatricians have concluded that this is not caused by the virus per se and happens much later after the virus has left the body. Once the virus enters a pediatric body, it triggers an antibody response and certain elements in the bloodstream are triggered to help fight the virus, like cytokines and other antibodies. Once the virus leaves the body, these cytokines and antibodies go on an upward surge and forget the virus. They start damaging every organ, every cell of the child's body. Hence the name multisystemic inflammatory syndrome. Okay, let's start with the good news. The good news is MISC in COVID children as of now we've seen in very or heard of in very few children. So I don't want parents to think about their child potentially getting MISC post-COVID. Yes, but on the other hand, I want the parents to be aware to look out for red flags and signs in case the child is heading towards that particular phenomena. So this is in the post-recovery phase where the child has been through the 7-10 days of fever. Actually, it can come anytime. It can come on the 4th or 5th day of fever. It can come 3 weeks after the fever. Look out for sudden worsening of your child's overall condition. Lethargy, vomiting, drowsiness, like a very sick child. So the minute you feel the child's suddenly again becoming very sick, let the alarm go off, call your pediatrician immediately. I'm sure your pediatrician is aware of this existing condition and will do the needful. So yes, these are wide ranges of COVID that children can go through. I just want to reassure the parents that they've heard of MISC, but don't panic. It's very uncommon so far. Affected moms should breastfeed. They should breastfeed because they can and have an opportunity to give passive immunity to their child through the IgGs and the IgAs that they're building against the COVID virus. Now, if the mother is sick enough to get hospitalized, no, we stop breastfeeding because then she'll be taking medications which the baby should not be getting through the breast milk. But if she's only on symptomatic medicine, resting at home, not that sick, just COVID positive with mild COVID symptoms, wear a double mask and please continue breastfeeding your child. We strongly encourage it and we strongly recommend it. If you as a parent are infected, now in a nuclear family, let's take it as a mother, father and the child is not infected, but the mother and father test positive for COVID. If the child is less than 3 years old, let the mother, obviously the child is either breastfeeding or is more attached to the mother, let the mother take care of the child with the mask on at all times. If the child is more than 3 years of age, between 3 and 12, 3 and 10 years of age, let the parent who is less affected, less symptomatic, take care of the child wearing masks at all times. And if the child is 10 to 12 years and above, they can self-isolate. They can take care of themselves for next 10 to 12 days, that their parents recover, become maybe non-infectious, and then rejoin the family circle. But it all depends on the age of the child. It all depends on the structure of the family. But most importantly, if there's any family having a parent more than 55, 60 or a grandparent more than 55, 60 years of age, please do not involve them in extra caretaking, because if the child is given the responsibility, if the child's responsibility is given to the grandparent, and if the child's in a carrier state, there even the minutest possibility of a grandparent getting infected as of now is not on our wish list, because they tend to bear the heaviest repercussions. So keep them out of this. Above 55, 60, do not let them come in contact with anyone who can potentially have symptoms or can carry the virus. So I would suggest let the healthier parent mask up and take care of the non-infected or affected child till they recover. A lot of recent parents that we meet and we find out that the kids are positive, it comes as a big shock to them, because the first thing they say is, "Doc, it's impossible because we've not stepped out of the house. We've been really self-quarantining. We've really been disciplined about it, especially for ourselves and for our children." Now, the thing is, latest research shows that this is now an aerosol infection, meaning once a person sneezes or coughs it out, the virus has the capacity to hang around in the air. So that suspended virus in the air is a little bit of a problem for kids, because what happens is, if there is someone, we've taken up precautions, we keep the kids and someone comes in and coughs and goes away, or we take them to an environment where nobody else is there as of now, but someone has coughed and left those particles in the air, and we go there and breathe in. And even when you step outdoors, there's a tendency of removing the masks. Unless until you're in a very open, windy place, do not remove your mask even if you're outdoors. And secondly, ventilate your homes. People have a tendency to shut everything, preventing any air to come in and hence the infection. No. At least every 3 to 4 hours, open all the windows, we get the air circulation going, and let the particles in the suspended virions, if viruses, if any, leave your house immediately. Overall diet, because I'm going to answer the next diet question as well, is the key to immunity. So 2 things: well-rounded diet with good amount of proteins, carbs, mineral, vitamins. Make sure they have significant amount of each compartment. There is no dearth in one specific compartment. And second is good sleep. I want to lay more emphasis on that because good sleep in children builds good immunity. Make sure they get at least 8 to 10 hours of sleep. Make sure that if they're sleeping, plan to sleep at 10 and 11 in the night, 2 to 3 hours before that, they have completely disconnected from their digital appliances, no iPads, no phones, no screen time 2 to 3 hours before sleeping, because they may be on their screen till the last minute, but once they turn the screen off, their brain still stays active for 2 to 3 hours, and that prevents the first 2 to 3 hours of sleep, and also reduces the amount of deep sleep because of the constant stimulation. So the immunity drops on daily basis. When it comes to immunity boosters from multivitamins point of view, there have been only 3 that have been studied enough to help. Not to prevent the disease, because nothing can prevent the virus from entering your body, but it can prevent how your body responds to the virus. It can control the damage done by the virus. It can help in speeding up the recovery if infected. That is, these 3 are vitamin C, vitamin D and zinc. Don't randomly keep giving it to your children. Have a good plan around them, because the doses change as per their weight and age. So I would strongly suggest talk to your pediatrician at all times. Keep him or keep her abreast with what vitamins and how much you're giving your children, so the pediatrician can fine tune it and do what's best for your child. Very simple. A, do not test children who don't have symptoms unless until you've traveled and you compulsory put through a test by the society, by your household. It's another thing. And do not treat children with no symptoms even though they are COVID positive. The minute they are COVID positive but they don't have symptoms, you can make them wear a mask. You can follow isolation protocols like we've spoken. You can continue a multivitamin, but talk to your doctor. They will give you certain red flags to look for. But currently, if there are no symptoms, please don't get excited and over-medicate. Steam is a very, very important part of day-to-day routine now in COVID times. Steam is a little risky thing in children. Adults can control their posture, can keep their distance from steam coming out from boiling water at all times, but it's very difficult for kids to do so. Even at the slightest flimsy behavior, steam burns are very commonly seen, and we get calls a lot nowadays when they're pushing their children to take steam unnecessarily. So keep a distance from the steam. Yes, you can give them steam. What we also recommend is, run a hot water bath in a closed sort of a section. Let the steam build, shut the water, take the child in. That's enough steam. Number 2, you can use those steamers at a distance. A, it should not be that close that your child burns and cries, and it should not be that far that the steam doesn't have any impact inside. So the thing is, the steam should be close enough for this area to be sweating, but the minute you see it turning red, you've gone too far. So 10 months old, giving steam is a little risky, so I would suggest we avoid. So for prevention, I would genuinely insist for the next few days, please, next few weeks, please, keep the children indoors. Do not send them down. Do not think of having any play dates, parties, nothing. Stay home, stay safe.